Welcome back, dear viewers, and our second guest of the evening is Dr. Alaa Al-Saffar, periodontist and implant surgeon. Dr. Alaa, good evening and welcome to Hala Kuwait.
Thank you for having me. Thank you so much.
It's really a pleasure to have you tonight with us, and it's really an impressive journey you're still having with dentistry, and we're also wondering about this impressive journey. And when it comes to the field of dentistry, there is a lot of things developing day by day. And for example, technology, when it comes to technology, one of the most frequently asked questions nowadays when it comes to the field of dentistry is AI. How is AI currently being utilized in the field of dentistry, and particularly in periodontics?
So AI, first of all, thank you for having me. I wanted to touch up generally. AI has been currently widely being used in a variety of aspects in dentistry, such as pediatric dentistry to identify teeth, to identify the age of the patient. We also use it in cosmetic and prosthodontic dentistry for reconstructing smiles and shade selection and other aspects. In periodontal disease, or in periodontics in general, it's been used to detect implants, to see what types of implants have been used for plaque detection, and as well as diagnose periodontal disease.
Definitely. So let's go to the point of diagnosing, and your winning research. Congratulations for it. It's involved to using a deep learning based online platform when it comes to diagnosing periodontists, and also would like to know about the AI platforms that assist diagnosing such complex dental conditions. It's really something that needs to be explained, so will you please explain to us?
Of course. So first let me explain what is periodontitis. Periodontitis is the loss of supporting structures around the tooth. So there are many stages and grades and extents of periodontal disease. So what we were trying to do is use one type of AI to diagnose periodontal disease, and that's what's called the deep learning. Deep learning is an advanced type of AI. So what maybe you can see in the picture, what this type of AI or platform does, first it identifies the tooth. After identifying the tooth, we want to see how much bone loss around the tooth has occurred. And we want to see how much bone loss we have on all the teeth, not only one tooth. So what the AI does is first identifies the tooth, and then after identifying the tooth, it has to separate the crown from the roots, because the bone is mostly around the roots. So we have a structure called the CEJ line, and this distinguishes the crown from the root.
Exactly.
So the AI, what it does, it points out the CEJ line, and then it points out the bone level. It measures how much bone loss has occurred from the CEJ line to the bone level, and it measures this distance, and it tells you the staging or the severity, basically, of periodontal disease.
At this level of the interview, Doctor, we are really wondering about the methods you've used before when it comes to traditional methods, and also the previous technological methods you've been in experience in the field with. How can you compare it with the AI in detecting and diagnosing different diseases when it comes to periodontist?
So traditionally, or what we usually still use is to diagnose periodontal disease, we have to put into aspect three things. We have to put into consideration the medical history of the patient, as well as the clinical examination. So we use an instrument called the probe, and what we do is we measure the pockets and the amount of loss of tooth structure around the tooth. And we also use radiographic data, which is radiographs, to see the amount of bone loss that is occurring around the tooth. Now, in terms of AI, there are different types of AI. There is the AI which reads your clinical information to give you a diagnosis, and there is an AI which looks at the radiographs to give you a diagnosis. So you were asking about the accuracy of each as well, right?
Definitely.
So the accuracy, we did a study to compare the accuracy of using AI methods or just traditional methods in clinicians that were not specialists, such as students and residents. We compared it to a gold standard, which is a board-certified specialist in periodontics. And then we saw that a general dentist or a student, their accuracy compared to a board-certified periodontist, which we consider as an expert, is around 60%. And of course, the more knowledge the dentist has, the more experience, the better the accuracy of the dentist. And when we compared it to the AI has an accuracy of high 80 to 90% when compared to the expert periodontist.
If one of your colleagues asks you, or one of the students who are already studying dentistry, if they ask you about some of the key benefits that AI brings to dental professionals and also patients alike in terms of treatment and planning and execution, what can you tell them?
So it's very helpful, you know, to introduce new concepts to students. For example, like I said, in terms of diagnosing periodontal disease, the AI will tell you exactly why this diagnosis was chosen. So it can be very beneficial to teach people that are not familiar with the new classification system. It can be used to teach the students as well. In terms of, you know, the benefits for the students, there's always there's always a chance for students to use AI in their research field. It's currently been used widely, also to improve, you know, their daily practice. So AI is also used to help, you know, in clinical quality control. So you know, you can always look back and see if your x-rays are up to standard, your documentation is complete and accurate as much as you can.
So doctor, when let's go back in time during your studying and training at UT Health at Houston. What motivated you to choose these topics? What attracted you to the topic of AI in diagnosis and periodontitis? And also, how did it shape your current practice in periodontist? Tell us from the start how you choose this topic.
Of course. So UT Health Houston is the biggest medical complex in the world. One thing that distinguishes it is its love for innovation and, you know, discovery. So UT has a lot of research in terms of AI and its use in the medical field, especially in in cardiac and in cancer research. So its use in cancer specifically was widely used in MD Anderson. So I felt always curious to see how it was applied in the dental field and in periodontics specifically. So I saw it as an opportunity to advance my knowledge and get the best knowledge available to bring back home in order to help my colleagues and, you know, my fellow friends about, you know, AI, how it works, and how to apply it in our field.
That's great. One of the main concerns when it comes to the patients, they always have concerns when it comes to payment and also the cost of treatment when it comes to periodontists and, let's say, in dental health in general. When it comes to AI, how it can help to reduce this issue or this concern when it comes to patients? Yes,
so AI really helps in, you know, reducing misclassification or misdiagnosis of periodontal disease. And if you reduce the misclassification of periodontal disease, it helps you provide treatment for the patient in a timely manner. And if treatment is provided in a timely manner, this will reduce, you know, the consequences of, you know, possibly losing the tooth. So for example, there was a study done in University of Michigan. It's actually a very good study that looked at the cost effectiveness between, you know, treating periodontal disease using surgery, various types of surgery, compared to, you know, advanced disease in which the tooth had to be extracted and replaced with an implant. So they looked at cost effectiveness in terms of mean annual cost. And what they found was, according to them, with a follow-up of 10 years to up to 48 years, what they found was, you know, the cost effectiveness of actually treating periodontal disease and maintaining it is much more than actually extracting the tooth and replacing it with an implant. And this cost effectiveness also decreased with smoking. So if you were a smoker, the cost effectiveness was not really there.
When it comes to the AI in general, doctor, you might heard that still in the level of, let's say, childhood. The AI is still crawling in many fields. So the requirements and the significant amount of data to function, when it comes to functioning effectively, is it still challenging when it comes to your field and your community and your field of studies and applying it to do your job and to do your work and to do your research? Is it still challenging and it lacks data?
Of course. So the thing with AI is it needs vast amounts of data to learn, to act as an expert. So in terms of dentistry, yes, you have to provide as accurate and as complete data as possible. So that's why in our studies we had to always exclude any data that was incomplete or inaccurate, as well as, you know, there's also the quality and the quantity of, for example, the radiographs. So if the radiographs were not complete, or if the radiographs had you know, severe angulations or differences in their contrast where the AI would not be able to read them, it was not ideal to teach the AI to learn from this data. So in order for us to teach the AI to learn the best, we have to provide the highest quality of data for it to provide accurate results.
How do you see, Doctor, the future of AI and its impact in being applied to students at universities and colleges based on your academic background and also your clinical practice?
Yes, so the nice thing about where I have done my residency is that we actually used these types of AI and we tried them on students, and we saw how much benefit it brought to the students because it tells them exactly what they have been missing in the diagnosis. So in terms of teaching, it's an excellent tool to teach the students how to use the new classification system to diagnose periodontal disease, as well as, you know, provide feedback and provide research opportunities for students to learn about the AI field and to learn how to incorporate it into dentistry and periodontics specifically.
That's great. Well, thank you so much, Doctor, for being
Thank you so much for having me.
with us
Thank
on
you,
Hala
thank you
Kuwait,
so much.
and we wish you the best of luck with your future endeavors.
Thank you so
much, Doctor.
Thank you.
The viewers, we just had with us Dr. Alaa Al-Saffar, periodontist and implant surgeon. Let's go now and share with you our third report of the evening. It's about photography. We'll have a look at it. We'll be right back. Stay tuned.